Thanks for staying with us as we continue to reflect on South Africa's bid to prove Israel's genocidal intent in Gaza. We examine a key argument made by Dr. Adila Hassim at The Hague. She referenced UN Special Rapporteur on the right to health, Dr. Tlaleng Mofokeng, who already last year made the point that Israel's attacks on healthcare facilities and the refusal of humanitarian aid in Gaza was making life in the area unsustainable for its people. We speak now to Dr. Tlaleng Mofokeng to hear about the reaction on the proceedings at The Hague this week. A very good morning to you. Thank you so much for your time. The South African legal team has argued that Israel's war in Gaza is nothing short of destruction of Palestinian life and that the war could not be allowed to continue. What do you make of these proceedings, having listened to the arguments put forward?
I think the South African's legal team's case is probably some of the most important legally and academically and politically in modern history. And I think we would look back in this moment with a lot of pride that there was a nation in this world who were able to put human lives and human dignity ahead of any geopolitics or multilateral politics or the polarization of the world. And indeed, in terms of the right to health violations that Israel has perpetrated onto the Gaza Strip, but more broadly over the last 75 years on the occupied Palestinian territory, those conditions are incompatible with the realization of the right to health. There have been a loss of life, disabilities, continuing bombardment and destruction of underlying determinants of health such as food and water. And therefore, South Africa is correct by seeking the International Court of Justice to pronounce and make a decision to enforce a ceasefire up to their own mandate.
Among its 6 requests, South Africa is also demanding an emergency order to prevent even further harm to Palestinians. Medical supplies cannot enter the Strip. I mean, we know that the UN mission to supply a hospital was denied, which was the 5th such denial since the 26th of December. What does it tell us about the reality on the ground and what they're facing on a day-to-day?
What it proves is that you cannot appeal to the moral compass of settler colonialists. You cannot appeal to the moral high ground of people who are hell-bent on erasing entire populations of people. Early on, already in October, we issued the United Nations early warning that they need to step up and prevent a genocide. We have witnessed in the last few weeks a literal genocide. And there is no idea of a Gaza while there are bombardments happening. There is no idea or any successful plan for humanitarian aid that can happen while there is bombardment. You cannot take everything away from people and then demand that they be okay and content with that. You absolutely cannot extinguish the human desire for freedom, because that is what truly makes us human. It's that desire to self-determine. And the UN, throughout the decades, by the way, have reiterated that any country has a right, or any peoples have a right to defend their sovereignty. And therefore, this is not an issue that is only particular to the Palestinians. And Palestinians are not seeking special treatment. What they are seeking is their human rights to exist as a people on their land.
Yeah. As you issued the warning in October, did you, by any means, imagine the scale of destruction and disruption of lives?
I think one, based on the history that has, us as South Africans and myself having undertaken this mandate at the UN during the COVID pandemic, I didn't need to be told of what could happen simply because I myself am a childhood survivor of apartheid. I'm connecting to you now from Kwakwa, a former Bantustan engineered by apartheid, which were very close allies to Israel. And so I know firsthand the destruction of what it means to live under brutal colonialist, imperialist regimes. And so some of us were speaking from that very personal past trauma that we've experienced, and we're begging the world to step in before we repeat that slogan, never again. Unfortunately, never again is right now, and it's in front of our eyes. And the world has failed Gaza the same way it has failed all of the people in Sudan, in Somalia, in Congo, in Syria, in Iraq, in Afghanistan, in Latin America. And we really have to see that this is a fight for survival for humanity. And what makes us human is the ability for all of us to defend, to protect human rights of all people everywhere without any retreat.
Yeah. Well, Israel has asked the ICJ to throw out South Africa's case and argued that it's doing all it can to limit harm by warning of attacks. Palestinians are battling on the ground. There's no clean water. Diseases such as diarrhea and others are often deadly, are rife, and we know that they're often deadly. Another act is the military assault on the healthcare system. The wounded are deprived of life-saving medical care. As a result, the system cannot cope.
Absolutely. And we have to realize that an immediate ceasefire is the only solution forward for any kind of arrangement we would like to envision for Gaza. And so in the context of prevailing violence, there can be no humanitarian aid. I mean, the UN has lost most staff in any war in any history period. Right? We have doctors and nurses and healthcare workers who have died in excess of 300. We have journalists at the moment, the tally is gone up now to more than 220. So the loss of life, just even if you look at professionals alone, it tells you that there are mistakes and there are intentions that Israel are making to target these particular, not just infrastructure, but particular people as well. And we have to remember as well that the UN process at the International Criminal Court of Justice is happening parallel to the UN General Assembly. It's happening parallel to the Security Council. And the court cannot make itself less valuable. The decision the court makes will tell us, the rest of us, how seriously the court takes its own mandate. And we have to realize that the stakes are higher than they've ever been before for the multilateral system, for global solidarity. There are still more nations in this world who are committed to human rights. And it is my hope, and it is my advice always, that we have to center human life, we have to center human rights unequivocally, and we have to always choose dignity of all people everywhere and stand with people who are living under the crushing weight of oppressive systems. Hence, when I came in as a special rapporteur, I centered anti-coloniality and anti-racism in understanding the right to health. And we have all seen clearly in the last 100 days why that is so important.
Yeah, absolutely. And as we see very clearly the importance of this, there are also acts that suggest that Israel is actively preventing reproduction. These acts are against women, children and babies, and include an attempt to prevent births, even 180 births each day, and 50% are likely to experience complications, and no help is available. What does this tell us when it comes to the importance of this case and really emphasizing the health perspective, the right to health?
Even before October 7th, I've had to intervene and make urgent appeals and other interventions to the state of Israel in my capacity at the UN, appealing for them to allow Palestinians to move out of Palestine to seek care for cancer treatment, for reproductive health, for childhood illnesses. What has happened post-October the 7th is something incomprehensible, is something excruciating that none of us could have imagined. You have women giving birth via cesarean section without analgesia. There are no commodities, surgical commodities, or medical supplies for post-infection and postpartum care. You have children who are undergoing limb amputations without anesthesia. That is the most excruciating, but the literal bottom of the barrel of humanity. And if this is who we are as humans, we ought to take a step back and really reconsider if this is the path that we are charting for ourselves in this, ironically, the United Nations Decade of Peace, named after Nelson Mandela.
Yeah. And very lastly, before we let you go, I mean, the case, of course, is one that could take years, but we know that there are some short-term announcements that will be made during the next couple of weeks in terms of a decision on the short-term contingency measures. What are your expectations?
We expect that the court will do the right thing, both in international human rights law, in international humanitarian law, but as well as very directly the Genocide Convention in which South Africa brought. It is absolutely appalling and despicable that you have other former European colonialists and those governments and those states who have joined Israel in defending them in this court case. But what you also have is a rise in a voice and an authority and a moral authority in a way that we've never seen before from the Global South countries. And so we hope on the one hand the court will adhere to its mandate and resist political pressure, and on the one hand affirm the right of Palestinians to finally live and to be free ultimately.
Very well. Thank you so much for weighing in on this discussion. UN Special Rapporteur on the Right to Health, Dr. Tlaleng Mofokeng, speaking to the perspective on health when it comes to the matter, the ICJ matter brought by South Africa against Israel.